welcome to this webinar on European funding for cancer research. I think the numbers have now stabilized, so we'll make a start. My name is Kay Duggan-Walls, and I'm the national contact point for Horizon Europe in the Health Research Board. And today we're going to talk about European funding for cancer research, and I'll be joined by my colleague, Dr. Amanda Daly, who's going to talk about EU for health and cancer. So we'll be looking at all of the opportunities that are in Horizon Europe and other European programs for cancer research. So we will have an hour of presentations, and then we will have 15 minutes at the end for your questions. So I'd ask you to put any questions you have in the questions and answer box, not in the chat, and we will be looking at your answering your questions after both presentations. So I'm going to share my screen now on the first presentation. So as I was saying, that there are lots of different opportunities for cancer research funding, and they're all not in the same place. They're all not under Horizon Europe, and they're not all in EU for health either. So the first thing I want to talk about is the EU Beating Cancer Plan. And this is the EU's response to growing challenges and developments in cancer control. And it's a political commitment by the European Commission to leave no stone unturned in the fight against cancer. And now this initiative is led from DG Santé in the European Commission. And it aims to reduce the cancer burden for patients, their families and health systems. And it will address cancer-related inequalities between and within member states, with actions to support and coordinate and complement member states' efforts. And the cancer plan is linked to other Commission priorities as well and other areas. So the EU cancer plan, it proposes actions for all stages of the disease. So prevention, early diagnosis, treatment, quality of life and survivorship. So the funding for the EU Beating Cancer Plan, there's 4 billion available in several different EU funding instruments. So we're going to cover some of those instruments today. There's 1.2 billion available in the EU for Health programme, which Amanda will cover. There's 250 million available in Digital Europe, and there's one call open at the moment on cancer, which I will cover later on. Then there's 2 billion in Horizon Europe, and Horizon Europe is providing seed funding to the cancer mission for the next 2 years of 378.2 million. So I'm going to cover the calls in the cancer mission as well. There are 3 calls open at the moment. And also there are calls in the Innovative Health Initiative. And Martha Cahill, our colleague from Enterprise Ireland, who can't be with us today, has sent her slides, so I'll cover those as well. So there are opportunities in that programme as well. So these are the 10 flagship initiatives in the Europe Beating Cancer Plan. And I've given some examples here of the different areas where they're covered, and the ones in purple are calls that were in the EU for Health programme, which a number of them are closed now. There is also the first one there, the Knowledge Centre on Cancer. The Joint Research Centre has launched this Knowledge Centre in June 2021. There's also the Digital Europe call there on the next one, the European Cancer Imaging. And if you go down further down here, down towards the end, there's the Cancer Mission had a CSA to prepare for this, UNCAN EU, and there are 30 partners in this, and UCD is a partner, which it was just recently awarded. So there are lots of different opportunities for cancer research, and these are the ones coming from the European Beating Cancer Plan, which I said was led by DG Santé. Then there's the Cancer Mission, and the Cancer Mission then is the objective is to improve the lives of more than 3 million people by 2030 through prevention, cure, and for those affected by cancer, including their families, to live longer and better. And it's one of the research and innovation missions, and it's part of Horizon Europe. And this is led from DG Research and Innovation in the European Commission. And this cancer mission will inform many of the cancer plans actions, and it will draw on research and information. So it's an integral part of the Beating Cancer Plan. And both of these initiatives were developed in close coordination, and many of the mission activities will support the Beating Cancer Plan, and it'll create seamless links between research and policies. So the cancer mission has 4 pillars, and there's prevention, screening and early detection. Then there's optimizing diagnosis and treatment, and supporting quality of life, as well as improving the understanding of cancer. I'll be talking about the 3 topics that are open at the moment, and many of the topics will come. Many other topics will come again in 2023 and 2024. And to know which calls are going to be coming up in the future, there's a key document, which is the implementation plan, and I put a link there at the bottom of the slide. So if you click on that, that's the implementation plan. It'll show you where the future calls will be coming from. Also, I've put on the right-hand side of the slide a link to an information day on cancer missions that was held in January. And that's very good. It'll help you to understand the calls and the cancer mission. So this is just a list of the cancer mission recommendations, and a lot of them link in with the priorities in the Beating Cancer Plan. So the EU missions have synergies with a lot of EU policies and initiatives, and they're initiatives that can help achieve the goal of the EU mission on cancer, and I've listed some of them there. And then there are initiatives which act as enablers for the EU mission on cancer, and then initiatives that are expected to serve the mission. So this is an interactive guide which will help you look at the different areas where you can find actions on cancer and their synergies. So it displays a network of connections between action topics of the EU cancer initiatives of the Beating Cancer Plan, the mission on cancer, and the Knowledge Centre on Cancer. And I put a link there where you can look at this yourself, and if you click on any of the different areas, it will explain to you where the synergies are. And it may be up here at the top where you have the tobacco control or the regulation on alcohol consumption, and there's also the Healthy Diets and Physical Activity Initiative by the European Commission. So all of these things will link into research on cancer. So now I'm going to talk about the cancer mission calls for 2021. These calls opened on the 22nd of December, and they will close on the 26th of April. So there are 3 calls here open at the moment, and they're all research and innovation calls. So the first one is about developing new methods and technologies for cancer screening and early detection. And there's 60 million available, and calls would be in the region of 4 to 15 million. So they will be able to fund 10 projects. Then the next call is about developing and validating a set of quality of life and patient preference measures for cancer patients and survivors. And there's 11 million available for this, and they're expecting to fund 1 project in this area for about 11 million. And then the third call is better understanding of the impact of risk factors and health determinants on the development and progression of cancer. And there's 54.65 million available, and projects will be in the region of 4 to 15 million, and they can fund around 6 projects. And just to let you know that all of the slides will be available, and the webinar is being recorded, so the recording will be available later. So the first one of the topics that we looked at earlier was developing new methods and technologies for cancer screening and early detection. And this topic, you must have a readiness, a technology readiness level of 4 in whatever you develop. So the scope of this is screening and early detection should become faster and more precise and accessible and affordable. And the proposals should address all of the following. And you're also asked to look at the outcomes in the call topic as well. So based on weaknesses and gaps and possibilities for further development of existing screening and early detection methods and technologies, you have to develop and validate non-invasive or minimally invasive cancer screening and detection methodologies in everyday medical practice and have access to potential uptake of methods and technologies in national health systems and the target population and implementation needs. And you need to identify a target population and consider the implementation needs of that population and consider the effectiveness, affordability and accessibility when proposing a solution. And also you're asked to consider the use of living labs or other implementation research models that use open knowledge and social innovation systems and that support end user engagement. And the final point is you should take into account the influence of age and early life factors and determinants, genetic risk, socioeconomic status, behavioral, including lifestyle risk factors, environmental factors, and there's a long list of other factors mentioned. And these should be across all of the aspects mentioned above. So the next topic is the one for 11 million, and it's just one proposal that will be funded. So this is to develop and validate a set of quality of life and patient preferences measures for cancer patients and survivors. And the proposals should address all of the following, that you're to conduct an analysis of existing quality of life data from studies, surveys, and registries, and focus on patient needs. And to set up collaborative approaches with patients, communities, and multidisciplinary research teams, develop quality of life measurement tools and approaches to capture key elements of the quality of life from those affected by cancer that are not captured adequately with the established metrics. Your project must also cover subjective perceptions of positive and negative aspects of cancer patient symptoms, whether they're physical, mental, emotional, and so on, as well as needs for palliative care. You're to prepare and conduct a pilot of newly defined, harmonized, and systematic quality of life surveys across the 27 EU countries, reflecting diversity and unique differences. And the surveys should form a basis for comprehensive comparisons of quality of life of cancer patients and survivors across and within countries and between different groups. And you're to prepare the ground for further regulatory and extensive high quality data collection. And also to look at the influence of age and early life factors and determinants, genetic risk, socioeconomic status, and so on that we've seen in the previous topic. And also the most promising quality of life and preference measures and metrics should be validated as well. And this project will be up for 2 years, and the European Commission want to go very much in depth with the surveying in this particular topic, and that's why there's 11 million available for 2 years. And then the final topic under the Cancer Mission for 2021, it's a better understanding of the impact of risk factors and health determinants on the development and progression of cancer. And proposals should address all of the following again: develop systematic understanding of cellular processes with a focus on the transition from a healthy state to cancer initiation and progression at individual or population level. Demonstrate access to and use of multiple comprehensive databases in and well beyond health research and health domains, such as lifestyle, omics, clinical, indoor and outdoor exposure. So you're to build on longitudinal cohorts, case control studies, biobanks, registries, etc., and use state-of-the-art digital tools for data analysis and modeling. And then to analyze and integrate existing knowledge and high quality data from biomedical and clinical studies using AI, machine learning, to identify factors and determinants triggering transition from healthy state to initiation and progression of poorly understood cancer and cancer subtypes, including cancers in children and adolescents. And again, the influence of age in utero and early life factors and determinants, environmental factors, genetic, epigenetic risk, socioeconomic status, and so on should be considered as well. And then due consideration should be given to newly funded EU initiatives. And when preparing your proposal, you'll be asked to liaise with different initiatives. And also this topic should liaise with funded proposals and developing synergies with them, such as PARC and the Human Biomonitoring Initiative. So they're the three topics that are in the cancer mission, which is closing on the 26th of April. Now, there's also draft topics available as well. They're not available to the, they're still in draft, so they're not available at the moment, but just to give you an idea of what they are, there's going to be, now the tentative date that the call is supposed to be opening in May and closing in September, but that may change. There's a budget of 129.56 million, and there's 5 calls, and there's 2 research and innovation calls: improving and upscaling primary prevention of cancer through implementation research, pragmatical clinical trials to optimize treatment for patients, and then there's 3 coordinating and support actions to strengthen the comprehensive cancer infrastructures towards the creation of European Cancer Patient Digital Centre and creation of national mission hubs supporting the mission on cancer. And all of these may change because they're in draft format at the moment. And then there's also technical support for informing and engaging with citizens, developing and monitoring frameworks. And then there's a grant for workshops tackling cancer in member states. So the other opportunity I was talking about was in the Digital Europe programme, and there's the link to the Digital Europe programme. This programme has 50% funding, so you'll have to find the balance from somewhere else. The particular call that I'm talking about today, there's a budget of 18 million, and the title of it is Federated European Infrastructure for Cancer Images Data, and this opened on the 26th of February, and it's closing on the 17th of May. Now, there's going to be a webinar on the 8th of March on this, and I've put the link there to the webinar, so you can register for that webinar. Now, the cancer imaging data, this topic is to establish and deploy a pan-European digital infrastructure facilitating access to cancer images and related patient data in full compliance with the applicable data protection requirements. These images will be used by clinicians, researchers, and innovators, and the ultimate aim is of more precise and faster clinical decision-making and diagnostics and treatments and predictive medicine that will benefit citizens, patients, healthcare systems, and the overall economy. And the resulting data infrastructure will be interoperable with other components of the European health data space, in particular the genomic data infrastructure. So in order to maximize the societal benefits of the health data use, the data space should be supported by advanced IT tools and capacities, such as AI and HPC. And the measure will support creation of new cancer image data sets and further extension of the existing ones. And the infrastructure should consist of a central coordinated entity, a federated network of fair, conform connected data sources, a platform enabling data discovery, querying and capability to access appropriate computing capacities for distributed data analysis. And the action must combine existing data sources and support creation of new data sets. To ensure maximum data protection, identifiable data will be in principle be analysed using distributed data analysis and AI learning techniques, while fully taking into account the applicable data protection requirements and the EU's international obligations. And central storage may take place if the data are anonymized and in accordance with applicable legal requirements. And the project will be in compliance with the relevant legal, ethical, quality, and interoperability requirements and standards. And the project should also enable linking and analyzing cancer image data together with other types of health data in particular electronic health records, repositories of molecular and clinical information, and genomic phenotypic data. So these are the details of that particular call, but you can read it, the full details of the call on the participant portal under Digital Europe. So this is the Horizon Europe Health team. There's Patricia Clark, my colleague in the HRB, who's the national delegate. There's myself, the national contact point, and Martha Cahill in Enterprise Ireland, who is the national contact point as well. And now I'm going to present Martha's presentation about the Innovative Health Initiative, which she has kindly forwarded to us. So the Innovative Health Initiative is the successor to the Innovative Medicines Initiative, and it's a public-private partnership, and the funding comes from Horizon Europe and from industry. So it's a partnership with the EU and industry, and it is now broader than just the pharmaceutical industry, because you have medtech, you have biotechnology, you have vaccines, and digital health included. So the first call is expected to launch, or expected to open in June and close in September of 2022. And there is a link on the top there on IHI, and also the funding opportunities that are available in the links below. So the first expected themes and calls are outlined in that link there, and at least 2 of the calls are focused on cancer. Next slide, please. So these are the 2 calls focused on cancer. So it's next generation imaging and image guided diagnosis and therapy for cancer, and precision oncology, innovative patient-centric multimodal therapies against cancer. So these topics and the program is in development at the moment, so it may change, and the dates for the calls may change as well. So this is call 1, and these are single stage calls, and there's other topics such as innovative patient-facing care pathways for patients with neurodegenerative disease and comorbidities. And there's access and integration of heterogeneous health data for improved healthcare in disease areas of high unmet public health need. Next slide, please. And then in call 2, the 2-stage call, there's new tools for prediction, prevention, and monitoring of cardiometabolic diseases, including secondary manifestations, to enable timely intervention. And there's strengthening EU clinical development, excellence in innovation, attractiveness, harmonized methodology to promote the uptake of early feasibility studies. Next slide, please. So Martha will prepare a newsletter on the Innovative Health Initiative when it'll be launching, and there's going to be 2.4 billion available. And she will also run some webinars as well, and the European Commission, the IHI, will run some brokerage events and information days for further information. So the next slide, please. So I would encourage you to sign up to the Horizon Europe newsletter and click on health, and through that you will find the information on the IHI calls as well. So watch out, look out for that. So there's Martha's contact details, and you can contact her about she's the national contact point for health as well as myself, and she's the state representative for the Innovative Health Initiative. So Martha would be able to help you on the Innovative Health Initiative as well as Horizon Europe Health. So now I will call on my colleague, Dr. Amanda Daly, who's going to talk to us about cancer in the EU for Health programme. Thank you, Amanda.
Thanks, Kay. Thanks very much. Good morning, everyone. My name is Amanda Daly, and I'm the national focal point for the EU for Health programme. Just going to share my screen here, 1 second. Go. So some of you may be familiar with the EU for Health, and some of you may not, because it's quite a different programme to the Horizon Europe. So It's one of Europe's responses to COVID-19. It's the new and very much improved public health programme, but compared to its predecessors, it's much bigger and more ambitious. And this is accompanied by a larger budget, over 10 times the previous programme, of 5.3 billion euro. So, I mean, Europe is really pitching this as a real game changer for health and healthcare systems. So I just would like to highlight, though, that the difference between EU for Health and Horizon Europe. So Horizon Europe supports research and innovation across all areas, including health. EU for Health is dedicated to health, but it doesn't fund research per se. However, it does support the implementation of European policies and best practice. So it can support the uptake of research and innovation results, such as pilot studies of best practice. And I suppose the main objective of the programme is to support European policies. And as Kay discussed earlier, Europe's Beating Cancer Plan is very relevant here. 1.25 billion euro will be funded through the EU for Health programme to support Europe's Beating Cancer Plan. And just, I suppose it will run for the next 7 years. The general objectives of the programme are to improve and foster health in the Union, to protect people from serious cross-border health threats, to improve access to medicinal products, medical devices, crisis-relevant products, and to strengthen health systems. So EU for Health not only focuses on improving healthcare systems, for pandemics, it's not specifically addressing COVID, but it does address pressing health issues like cancer treatment, like the burden of non-communicable diseases, antimicrobial resistance, and healthcare health workforce training. So there again, there's of the 4 general objectives. Under that, there are 10 specific objectives, and all of these are, many of these are relevant to cancer. If we look here at strengthening health data, digital tools and services, digital transformation of healthcare, this is very relevant to cancer, and there was an action under the EU for Health programme to improve digital tools for the treatment of cancer. Also, enhancing access to healthcare is another example which is very relevant to cancer. Health inequalities is a major focus of this programme. So the EU for Health work programme is launched every year. And the EU for Health 2022 work programme was launched back in January. And similar to the 2021 programme, it has 4 strands of action under this. And this is disease prevention, crisis preparedness, health systems and healthcare workforce, and digital. But cancer is a cross-cutting theme across all these strands of actions. And so I'll just go through, just so you're aware of the opportunities under EU for Health. There's a number of different funding mechanisms, and these fall under 3 different mechanisms: grants, public procurement, and prizes. So because the EU for Health is supporting public policy, it has a major, it has the involvement of government departments and state agencies is quite strong. So these fall under the joint action. So there's dedicated funding given to different government departments, and this falls under joint action. So actions will come out and the government will be asked to nominate a government department or the nominees. And these nominees can be either the HRB, it can be the HPRA and the HPSC, to whoever who is relevant to a specific joint action. Action grants are your typical call for proposals, and these are open to any legal entity. So open to public bodies, private bodies, NGOs, and they're generally about 3 years in duration. In terms of eligibility, you wouldn't be applying as an individual, but rather as an organization. And although the eligibility criteria are not very stringent, the calls are targeted at very specific groups, such as public health authorities. They do include academia and education establishments, hospitals, civil society organizations as well. Public procurement is another huge offering under EU for Health. So similar to, I suppose it's similar to tenders and the contracts with economic operators to purchase services or goods. on the account of the Commission are launched, and all the tenders are openly published on the tenders electronic daily, and you can sign up for alerts for these. There's also prizes, and these are generally contests to promote the achievements of policy objectives of the Union. For example, last year there was an EU Health Award for cancer prevention, and this was targeted at cities, NGOs and educational institutions. I suppose that the grant funding comes with a warning here, because there is a requirement for co-funding, unlike Horizon Europe. So the Commission will fund actions to a level of 60%, that's the normal co-funding rate, but it can fund up to 80% of the activities, and this is in the case of an exceptional utility, but there are criteria to be met under this exceptional utility, and generally that is about getting a broad number of member states, so at least 14 member states, but including at least 4 of those which have a lower GNI per inhabitant than 90% of that union average. And then you can have at least 30% of the budget proposed to be allocated to those countries also. So I suppose that's more about the detail of it, but just that there would be a need for a co-funding, and this can come in, and is expected to come in-kind contributions through staffing employed by the applicant or organisation. So their time would be costed and put in as in-kind contributions, but there may be some travel funding required in addition to this, given the nature of these awards. So just in terms of what funding is available for cancer under the 2022 work programme for EU for Health, it actually includes, so there's 835 million for this year's work programme, of which 147 million is targeted to actions to fight against cancer. And 105 of these is supporting different types of cancers. So if we go through the different mechanisms, we have grants and we have action grants. So there are calls for proposals, 3 calls for proposals to a value of 48 million. Then there's a joint action in cancer, which will be targeted for the state agencies and the Department of Health. And then there's direct grants to international organizations also, so the likes of IARC and WHO. And there's also procurement. And I'm just going to go through these, so just in high level, just to give you a flavor of what's on offer. Under the calls for proposals, there are 3, as I said, and the first is to monitor and strengthen the implementation of innovative approaches to prostate, lung and gastric cancer screening at union level. And this was literally launched last week to a value of 30 million euro. I'll go through that now shortly. And the second is to support the rollout of the second cohort of the inter-speciality cancer training programme. And the third is call for proposals on cancer and other NCDs prevention and action on health determinants, and that's 11 million euro. So the first call on cancer screening, which is now open, is to look at monitoring and strengthening the implementation of innovative approaches to prostate, lung, gastric cancer screening at union level. And just to let you know, at this point, of that 30 million, there's 10 million targeted at each different cancer type. And the policy objective is stemming again from Europe's Beating Cancer Plan. And the aim of the action is to provide member states with evidence-based knowledge to be transferred to further design, plan and implement cancer screenings in these three cancer types. So what is supported under this funding? So it supports actions to optimize knowledge transfer between member states, to get a better understanding of the needs within each health system, and design and plan and the development of possible options for future implementation of targeted screening on prostate, lung and gastric cancer. So this is very high level. And there will be actually an information session next week, which I'll give you information on in a moment, which will go into it in more detail. The expected outcomes are evidence-based data, including the risk benefit and cost effectiveness studies and trials, and to provide member states with essential information for the design, planning and rollout of potential lung, prostate and gastric cancer screening, including strategies and target groups to take into consideration. So the targeted applicants, as I said, they can be quite broad. So we have academia and education establishments, research institutions, national and regional health authorities dealing with cancer screening programs. So you would imagine there would be a need then to kind of bring in the likes of the HSC with the cancer screening program involved in the hospitals and civil society organizations for this call. Again, for budget wise is 10 million for each of the different cancers. In terms of what they will fund, they'll fund up to 3 proposals, each proposal addressing one different subtopic, but it is possible for applicants to cover more than one subtopic. Just as the recommended duration is 24 months, and you can come in as a consortium composed of at least 3 applicant countries established in 3 different eligible countries. So that the consortium requirements within EU for Health vary. So you can kind of either come in as a sole applicant with European reach essentially, or else as a consortium. And this is just the information on the information session on the first wave of calls for action grants, which is taking place on Thursday, next Thursday, the 10th of March at 10 o'clock Brussels time. So that's 9 o'clock our time. So the second call that is planned for 2022 is on inter-speciality cancer training program. Now, under the 2021 program, the Commission launched a call to develop an inter-speciality training program, and this was, to develop a curriculum to support and train medical doctors and nurses and other specialized staff working in cancer centres in 3 different specialities of clinical oncology, surgery, radiology, and radiation oncology. And the aim is was to optimize an inter-speciality approach and cooperation. This follow-up call is the rollout of this training program. So you would imagine other sites would get involved and partake in this training program. Now, I know there was a named Irish participant in the last call, but I think we would need to get involved and look to roll out this interspecialty training in Ireland too. So that's one option. And again, the policy objective is to support Europe's Beating Cancer Plan to build a stronger multidisciplinary cancer workforce. And the activity supported is about a selection process for trainees, trainers and cancer centres, and the training to support the actual training on the curriculum that was previously developed under the last call, and includes technology-based learning, simulations and on-the-job training. So ultimately the expected outcome is to increase the coverage of this training program across the Union, resulting in upskilling and reskilling of health professionals across mainly the 3 areas of clinical oncology, surgery, radiology and radiation technology, and nurses as well, and other specialized services involved in that. So then we'll just move on. Oh, so the targeted applicants are similar to the last one. There's a budget of 7 million. And that 7 million, as I said, is 60% of the funding, which will be spread across the different member states involved in this call. It's not due to launch until Q3 of this year. So there's a bit of time to start preparing for that if you're interested. The third call is on cancer and other non-communicable diseases prevention, action on health determinants. Now, I refer to the joint action that was to be funded under the 2022 work programme, which is funding to go towards the Department of Health or relevant agencies. There is an identical joint action on cancer and other non-communicable diseases prevention, action on health determinants as well. So there's a call and a joint action on the same topic. And the idea of this call is to complement the implementation of the joint action led by the member states. And it's again to support Europe's Beating Cancer Plan to reduce the burden of cancer. So the idea would be that the policy and then any other actors involved would be communicating and collaborating on this activity. So as I said, they'll run in parallel. It could involve civil society organizations and their efforts in the design, planning and implementation of best practices, the production of public health guidelines, patients and caregivers consultations, or other actions that can benefit citizens directly, the preparation and rollout of innovative practices, a pilot test, or support actions such as training, twinning, and health communication or health literacy. So the expected outcomes is on disease prevention and health promotion, which is ultimately to reduce the burden of cancer and other non-communicable diseases in member states, because it's recognized that there are similar health determinants for cancer and non-communicable diseases. So it's targeting those as a whole. Targeted applicants are academia and educational institutions, civil society, supporting priority areas, and there is a budget of 11 million here, which is quite significant, and it's not due to launch until Q3 2022. And the final slide is on the public procurement opportunities under EU for Health in the area of cancer or related areas. So one is on tobacco control policy, implementation and modernisation of tobacco control legislation. So there will be a tendering process for 4.1 million to provide a service for that. There's a study, I mean, there are a number of studies here which I think could be conducted by academic institutions. So the study on the effectiveness of health information on alcoholic beverages, study on the evaluation of the EU Action Plan on Childhood Obesity, it's 1.5 million, study on obstacles for cancer survivors to return to work, 500,000 euros, development of a code of conduct on fair access of cancer survivors to financial services, 2 million, mapping and evaluating the implementation of Europe's Beating Cancer Plan, 1.5 million. So that's the number of public procurements there. So that concludes my presentation on the opportunities under EU for Health in the area of cancer. I'm happy to take any questions. We have a dedicated EU for Health page on the HRB, which I will include in my slides once we send these on to the applicants, or sorry, to the participants today. And for any queries, please contact me on amanda.daly@hrb.ie. Okay. I'll hand you over to Kay now, who's going to take any questions that have come up throughout the session. Stop sharing now for a second.
Thank you, Amanda. That was very comprehensive. Yeah, there's a number of questions now. We have questions both in the chat and in the questions and answers. So if you bear with us for a few minutes, I think the majority of them in the chat seem to be for you, Amanda. If we take a 5 minute or less than 5 minutes break, and we'll go through the questions. Is that okay?
I'll just take one here, and this is one from in the Q&A. Amanda, can a group of researchers apply to an action grant as their HEI? So I mean, ultimately it will be a PI or a group of researchers that get involved, I suppose, and lead out on an action, but it will be considered as an organization, will be the applicant, the lead applicant will be the organization, but a group of researchers can apply to an action grant, absolutely, yes. I'll just come back. Okay, so Patricia Doherty from TCD has asked, for EU for Health co-funding requirements, can all co-funding be in kind, or is there an expectation of some cash contribution? So we did have a session on EU for Health with the Commission last November, and there was a very clear guidance there on this issue, and there's an expectation that that up to 80% will be towards staffing and in-kind contributions, but there is a requirement for travel and potentially for other documentation or hosting of events that could require some cash contribution also. Yes. So William Gallagher's asked, in terms of the co-funding requirement, is this based on direct or indirect costs? So this is direct costs. Yes, this is direct costs of what you will cost your activities, and you will provide co-funding on the basis of your projected costs. In terms of the level of interest of academic institutions do participate in EU for Health. There are challenges, obviously, with the co-funding requirement, but the co-funding can come from literally anywhere. And then there is a huge portion of it coming through in-kind contributions. I know there was, and we have other players within. I mean, for all of the calls last year, we had between 5 and 10 applicants participating in different activities. So it's growing. There wasn't as much interest before, but we would like to see that grow, given the fact that the funding is much higher now. To support this, actually, the HRB and Enterprise Ireland, we are allowing the coordinator grant that is applicable for Horizon Europe. You can apply for this coordinator grant for Horizon or for EU for Health also. And we are looking to see if there is any way that we can assist in the co-funding requirement. We're exploring opportunities to support the co-funding requirement, but that's still nothing's set in stone there yet. Liam also asked about you're asking specifically on the inter-speciality training program. Is participation in the previously funded program a prerequisite of participation in the new program? And it would be useful to disseminate any prior success if possible. So the call for the previous the previous call is not yet closed, so we don't know the success of that yet, but I'm hoping it'll come shortly. I'm aware of the coordinator. It was a European body, and I've been in contact with them, and it's absolutely not a prerequisite for getting involved in this second call, because the idea is to expand it to other countries. So I would see the fact that if Ireland, I mean, I think that there was just a nominee from Ireland that wasn't involved in actually rolling it out here in Ireland, but I think there would be it would be really, it's absolutely not necessary for Ireland to have been involved in the previous program to get involved this time around. And if anyone is involved, I'm aware, and so the European Cancer Organization led out an application, and they are eager for Irish applicants to join. And so if anyone is interested, to come to me, and I can put you in contact with the relevant body, and they will, if they have been successful in the previous call, that's the only caveat there. But hopefully that will have been successful. So that's where we're at with that. I don't know, Kay, do you want to come in on any questions there? I can't see any more from me right now.
Yeah, there was one for me. It was about the draft topics for 2022. They're not available at the moment, and they may change. So I would imagine they will be published quite shortly if they're expecting to open in May. But I think the important thing is to look at the implementation plan, and that should help you visualize what calls would be coming down the line in the future. I think there might be one more question for you, Amanda, on the joint actions. I think, can you see that one?
In the chat or the questions? Sorry.
In the chat. It's on financial joint and several liability.
Okay, so Patricia Doherty from Trinity mentions here that with the action grants, the contracts have a clause for financial joint and several liability and some Irish universities are not listed for this full liability, and so it would have to be considered. Yes, I take your point, Patricia. There may be some obstacles there, but I know there are other universities that have overcome this challenge, and hopefully we'll be able to work something out here. I'm not sure what that would be, but I'll have a discussion with you offline about that. I think that needs further investigation. Thanks.
There's the final one for you, Amanda. In the scope of the EU for Health is at the end of the chat there. Any tips regarding consortium formation? So
it is actually quite challenging for EU for Health for developing a consortium. There is on the funding and tenders portal, there are partner searches that you can undertake. The best thing to do is actually to come to me first, because I have a network of national focal points across Europe, and I'm actively engaging with them on if they know of interested parties or organizations from different countries that are interested in different calls. So I think if you are looking to form a consortium, come to me first, and I could hopefully lead you in the right direction, or if not, put out the feelers to my colleagues to try and find other member states that are interested in getting involved. So yeah, that's that one.
There was one question on the Innovative Health Initiative, but what I can do is put the person directly in contact with Martha, and she'll be able to answer that one. I don't think there are any more questions unless anybody has anything. Another few minutes left. And just to follow up on what Amanda was saying there about forming consortia, there's a blog on the HRB website on forming consortia for Horizon Europe, and we'd have the same contacts as well. We'd be able to help researchers for Horizon Europe find partners, and also to use the funding and tenders portal.
That's great. I think, yeah, we'll follow up with the slides, and we'll include some links, especially to what we've a dedicated EU for Health program on our website, or page on our website, with all the latest details there to direct you to the relevant links. And I mean, ultimately, if you have a burning question, just email me, and I can, best I can. At the time, some things are still being worked out, so you'll have to bear with us, and once we get information from the Commission, we'll send it on.
And the 3 mission calls are available, and if anyone has any queries, either contact myself or Martha Cahill in Enterprise Ireland. And then the draft calls, they'll be made available as well. And also there are still, there are opportunities in Horizon Europe for cancer, unless it specifically says it's not a cancer topic. So there are lots of opportunities, but I suppose it's difficult to find where they are. So I was getting in contact with either myself, Amanda, or Martha, and we'd be able to guide you to where the calls for cancer are. So I'd like to thank you all very much for attending today. We had a very good attendance, and the slides will be available, or the recording will be available on the HRB YouTube channel, and the slides will be made available as well. So thank you all very much for attending, and wish you luck in your applications. Thank you.
Thank you, everyone. Bye now.
Bye. Thank you.
Bye-bye.